A randomized trial of high-flow oxygen therapy in infants with bronchiolitis. Definition: a bronchiolitis is an acute lower airway lung disease that is generally caused by respiratory viruses. It is the most common reason worldwide for non-elective hospital admission in infants. Pediatrics guidelines recommend only supportive therapy that includes oxygen therapy for hypoxemia, respiratory support, and the maintenance of hydration.
What to expect when your child has bronchiolitis. Bronchiolitis is a common illness of the respiratory tract. It is caused by an infection of the tiny airways that lead to the lungs. Children under age 2 are more likely to get bronchiolitis than older kids or adults because their small noses and airways can become blocked more easily. If your child has bronchiolitis, they will often cough, have a runny nose, wheeze, and breathe fast, and sometimes will have a fever or gag and throw up after coughing. Many children get better from bronchiolitis at home, but if breathing or drinking fluids becomes difficult for your child, they may need to be treated at Children's Hospital Colorado. While your child is getting better here, they will probably receive extra oxygen. The oxygen can be given either through a low-flow nasal cannula or a heated high-flow nasal cannula. Your child's nurse or respiratory therapist will help clear the mucus from your child's nose with either bulb suction, wall suction with a mushroom device, or deep suction with a nasal catheter. Suction can be uncomfortable for kids, in the same way that it's uncomfortable for them to blow their noses. Your nurse and respiratory therapist will only do it as often as necessary. You'll
Applications in medicine. High-flow oxygen therapy through a nasal cannula has emerged as a new method to provide respiratory support for respiratory disease in neonates, infants, children, and adults. Humidified and heated air that is blended with oxygen and delivered through a nasal cannula provides a degree of positive airway pressure.
What is bronchiolitis? Bronchiolitis is a tiny virus that gets into the airways of the lungs and makes it hard for your baby to breathe. Symptoms will start in 2 to 3 days and peak on days 4 through 7. Your baby will slowly get better over the next 2 to 3 weeks. Treatment at home. When you take your baby home, follow these simple steps. Keep your baby comfortable. Make sure to suction your baby's nose. It will help them breathe easier and eat better. It is best to suction before feeding. Be sure to wash your hands before the suctioning process. First, saline drops can be used to thin the mucus. Close one nostril and insert a squeezed flattened bulb just inside the open nostril. Release bulb to create suction. Remove from nostril. Next, squeeze the mucus out of the bulb into a tissue. Do not use a blanket. Baby should not sleep in an adult bed, on a couch, or on a chair alone, with you or with anyone else. Do not smoke in the home, vehicle, or anywhere where the baby lives and plays, even when the baby is not around. Wash smoke residue off clothes, furniture, and hands. Please reference your Safe Sleep handout for more information. Need help stopping smoking? We can help. Contact the Stamp Out Smoking hotline at 1-800-QUIT-NOW. Prevent the spread of viruses. All family members ages 6 months or older need the flu shot. Return to daycare. Your baby can return to daycare upon their approval, and if your baby is fever-free for 24 hours and feeding well. Return to the doctor. Take your baby to the doctor within 1 to 2 days of leaving the hospital. Monitor how your baby is eating and breathing at home, and share with your doctor. Your doctor will measure your baby's weight during your visit. Talk to your doctor if milk intake is reduced. Your doctor may recommend clear liquids with electrolytes. Emergency room. Go to the emergency room if your baby displays any of the following symptoms. Poor feeding. No wet diapers in 6 hours. Breathing faster or working harder to breathe. Fever if your baby is less than 1 month old. Apnea. Pauses in breathing for more than 15 seconds. Exhaustion. Cyanosis. Blue
Pros and cons. Pros: decreased work of breathing, improved oxygenation, and reduced rates of intubation are associated with high-flow oxygen therapy. The Kaplan-Meier plot showed a higher rate of treatment success among infants treated with high-flow oxygen therapy. Cons: the result in fewer infants having treatment failure that leads to the escalation of care. Those who receive standard oxygen therapy and a log rank test confirm a lower hazard of treatment failure in the high flow group.
What is bronchiolitis? Bronchiolitis is the inflammation of the lungs caused by a viral infection in children, usually less than 3 years old. Is more. Since the disease is viral, antibiotics won't cure it. They may be used for complications only. Also, breathing treatments with albuterol rarely help and can cause additional side effects, such as increased heart rate and decreased blood oxygen levels. Most cases of bronchiolitis can be managed at home with good hydration and nasal suctioning. Symptoms will often improve in 3 to 5 days. Bronchiolitis is a diagnosis your child's doctor can make with a thorough exam. In that case, their doctor will write a prescription so they may visit the Via Christi suctioning clinic once or twice a day until their lung inflammation begins to heal. Bronchiolitis can occur several times during childhood, but thankfully is usually more mild each episode. Learn more about nose suctioning by going to Via
Issue. Among these 167 infants, 61% had response to high-flow rescue therapy. 39% rescue high-flow therapy was ineffective, and the infants were transferred to an ICU. Overall, 2% were transferred from a hospital without on-site ICU to another hospital. A total of 1% underwent intubation, including 8 infants in the high-flow group and 4 in the standard therapy group.
This time last year, I was really worried about our 4-week-old daughter Luna's breathing, so I took this video of her. This clip has now been watched over 2 million times. Common in premature babies, Luna was born at 36 weeks, or those with a heart or a lung condition, and those under 8 weeks old. Bronchiolitis is caused by something called RSV. It's a virus which is spread through droplets of liquid from the coughs or sneezes of someone who has the virus. Thankfully, most cases are mild, but some babies and children will develop more serious symptoms which do need to be treated in hospital. Around 1 in 3 children in the UK will develop bronchiolitis during their first year of life. The infection causes the smallest airways in the lungs, the bronchioles, to become infected and inflamed. Bronchiolitis is most widespread during the winter, and it's possible to get bronchiolitis more than once during the same season.
Conclusion. In conclusion, the randomized controlled trial involving infants with bronchiolitis showed a significantly lower rate of escalation of care due to treatment failure when high-flow oxygen therapy was used early during the hospital admissions than when standard oxygen therapy was used. Thanks for watching.